Hi, and welcome back to the Fertility Now channel. My name is Lauren Brown. I'm a doctor of traditional Chinese medicine and clinical director of AcuBalance Wellness Center in Vancouver, British Columbia, Canada. Our website's acubalance.ca. And today I have the privilege on our Fertility Now discussion to have my associate, my colleague, my friend, Allison Locke. She practices at AcuBalance as well. She is a registered traditional Chinese medicine practitioner, so she's certified in acupuncture and herbal medicine. She's also a fellow of the American Board of Oriental Reproductive Medicine. She is a member of the Obstetrical Acupuncture Association, and she's also certified in laser therapy and a registered yoga teacher. And I know she shares or self-proclaims herself as a stage 3 endo warrior herself. And we're going to be talking about endometriosis. Allie, it's so good to have you on Zoom besides just walking around the clinic with you.
Yeah, I know. It's good to see your whole face. And I'm excited to have this chat.
I always see you in person, and now I'm seeing you on Zoom. It's like everybody wants to see everybody in person. I'm like, hey, it's so nice to see you on Zoom.
It's true. It's the opposite.
But it is nice to see your face without our mask because we're filming this still during the mask time. So
yes.
And we want to talk about endometriosis. And I know this is your passion. We see a lot of this in the clinic. You kind of want to start with just real brief, like kind of what is endometriosis and what are the main symptoms of endometriosis?
Yeah, sure. So endometriosis is when tissue that is similar to the endometrium grows outside of the uterus. So it grows on the peritoneum, it grows on various organs, on the pelvis. And so pain is the number one symptom. That's what usually gets people to the doctors. Full periods, there's painful ovulation, there's pain throughout the cycle, pain with bowel movements, with intercourse, with urination, spotting before your cycle, really heavy, clotty periods. So those are kind of some of the main go-to symptoms for endometriosis.
And a lot of the women we see in AcuBalance, they either having the pain or spotting, but they're coming because it also can impact their reproductive health, their fertility.
Yeah, absolutely. Yeah, I think the statistics say about 40% of women with endometriosis also struggle with infertility, but 50% of women that struggle with infertility have endometriosis. So it is a huge population.
Does a patient come to mind when you think of the endometriosis and just kind of the natural approach where they can get some resolution to the symptoms associated with endometriosis? Would you like to share at least one of those stories? Because I know you have many.
Yeah, absolutely. One that comes to mind. I started seeing a patient a few months ago. She's in her late 20s, and she was recently diagnosed with endometriosis because she has like a 4-centimeter endometrioma on one of her ovaries. And her doctors basically just discharged her, and she didn't really get good care, and she had no idea what to do. So she came to us because she really wanted like a whole plan of like how I can manage my symptoms. What do I need to do? So we did all that. We went through, we do diet, lifestyle. We did some supplements, and then make sure she's doing some stress relief because stress was pretty high. And then we did acupuncture. We didn't do laser in her case, but we did do acupuncture 1 to 2 times a week. And after the next period that she had, which was about a month later, she had no endo pain whatsoever. And that was pretty amazing for her. It was the first time where she was like, oh, I can actually walk around during my period. And then, it was up and down for like the next couple of cycles because she had a lot of life stuff happening. But then it came a point where she was like, hey, Allison, can I go skiing tomorrow? Like, I know I'm going to be on my period, but is that okay? Like, can I do that? And I'm like, yeah, absolutely. Like, that's amazing that you feel great enough to go skiing on your period, when before she used to be like completely bedridden and, had so much pain throughout her entire cycle. But now she just had, mild cramps that were totally manageable during her period. And she was able to do all the things that she wanted to do during her cycle. And yeah, that was pretty empowering.
It's nice when you can give back that quality of life. And we like to practice an integrated way. So we work with the conventional system closely. And some women will have surgery. Some women will use, birth control pill, which doesn't really support those women that are trying to get pregnant if they're on birth control.
Exactly.
And then there's the anti-inflammatory drugs, which have their side effects and it can impact with ovulation implantation.
Yes.
So I wanted our listeners to kind of know the natural approaches, things that they can do and how you're addressing it at our clinic. So you want to talk a little bit about our approach to endometriosis and why we're doing this multifaceted natural approach?
Yeah, absolutely. So endometriosis, there's so many factors that go into it. And well, first and foremost, it's a full body systemic inflammatory disease. And there's a whole bunch of other components that go into it, such as autoimmune health and gut health, and then also hormone imbalance. So I find that addressing all of those different factors at once in one treatment plan, I get the best results.
I want to emphasize on, you talked about gut health, that microbiome, because a lot of the interviews I've been doing with other experts, they're starting to talk about the gut microbiome and how this is impacting fertility in general, but also endometriosis. So can you kind of list some of the things that we're doing? Dietary therapy, obviously, if we're talking about gut health, but can you kind of just list, if somebody's going to come in and you're going to do this whole body approach with them, what are some of the things that they could expect to experience or receive as part of the treatment that you're offering?
Yeah, so for gut health specifically, we definitely look really into diet. So we do need to do, the anti-inflammatory diet. There's no one sort of endometriosis diet, but generally focusing on anti-inflammatory. So that's not too much processed foods, sugar, gluten and dairy if you're sensitive to it, alcohol. So working on making sure the gut lining is nice and healthy. There's not a leaky gut component, because that's going to sort of irritate the autoimmune component of endometriosis too. So it's all works really hand in hand. So for gut health, we definitely do diet. There's definitely probiotics have been really helpful for endometriosis, and then addressing any underlying infections like H. pylori and SIBO. SIBO is kind of considered like one of the sisters to endometriosis, because I think there was one study that showed that 80% of women with endometriosis also have SIBO. And so addressing that bacterial overgrowth in your intestines can really help reduce pain. And I do see that in my patients when they're addressing their SIBO, that their painful symptoms decrease significantly too.
So we're going to talk more about some of the natural approaches. And as we leave the gut health, the reason I wanted to emphasize this is it's not always digestive issues. If you have a microbiome issue, you can have sinus congestions, you can get like weird skin rashes and infections, you can have anxiety and depression. It's the systemic approach to the body. And so some people think, well, my bowels and my digestion are great. There still could be something going on there. But definitely if you're having a lot of digestive issues, if you're getting a lot of sinus stuff, there's often a link to the gut health.
Yeah,
so I just wanted to, because it's one of those things that it's currently being overlooked.
Yeah.
And then can you talk about things that I know that a lot of practitioners like yourself are using around the world, but the acupuncture, because you're working on inflammation and regulating hormones when you're treating endometriosis and healthy liver. So can you talk a little bit about acupuncture and laser therapy, and also maybe a little bit about herbal medicine? And then I kind of want to know kind of some of your favorite supplements. I'm kind of curious to see what you can share with the public on that. So can you talk about the acupuncture and laser to start with?
Yeah, definitely. So I definitely like to use both for my endo patients and herbal therapy too. I like to use all of my tools just because they're usually first coming to me in so much pain. So I just want to use all of the tools that we have to sort of really initially decrease some of the major symptoms so we can kind of get things more stable and address the more underlying things. But acupuncture is so great for reducing inflammation and just increasing the blood flow to the pelvic area, so there's less cramping in the muscles. It's been shown in so many studies to reduce period pain. It reduces inflammatory molecules. It's, really good for activating and help regulating the nervous system. So when you're activating the parasympathetic nervous system, you're taking the body out of fight or flight mode, which, helps the body heal, because you kind of need to be in the parasympathetic mode in order to heal. So that stress component is, I find, really helpful with the acupuncture. Laser is also one of my favorite things to use for endometriosis, mostly because it is so incredibly anti-inflammatory. So the laser uses the red and infrared light to, promote blood circulation, reduce inflammation, and promote ATP production in the mitochondria of your cells. So it helps your cells heal and repair, regenerate, create new healthy cells, which is really important for endometriosis because there's so many, injured and diseased tissues. And I also find that the laser itself is a really great protective mechanism against adhesions post-surgery, because that's one of the complications. And one of the cons of surgery is that we tend to have a lot of adhesions just from the doctors going in there and removing some of the lesions. So, and the adhesions can also cause significant pain post-surgery. So whatever you can do to help increase the blood flow and reduce those kinds of cells in the body will help reduce pain too.
With the laser, and a lot of it, what I like, when we talk laser, we're not talking about a surgical high power laser, hot laser. We're talking about low level laser therapy, also known as photobiomodulation. Can't cut or burn you, but I like it because it has more of a curative effect rather than just simply modulating symptoms by regulating inflammation, softening scar tissue, increasing blood flow. We learned about this through the Norman Doidge wrote a book. I think it was the Brain's Wave Healing. And he had interviewed Dr. Fred Kahn, who was a vascular surgeon who was using low-level laser therapy. And he was helping some women with their endometriosis that ended up not needing surgery. And I was fortunate enough to visit him, and he shared his protocols, which we use in our clinic. And then I got to visit Roberta Chow in Australia, and she uses it for endometriosis. We had some discussions, and we've been using it in our clinic with the diet, the supplements, and the acupuncture. And it's been another well received from our patients. And for anybody else, practitioners out there, I highly recommend if you get the low level laser therapy, it can really make a massive difference in not only symptoms, but helping resolve some of this endometriosis pain and spotting. So,
yeah, absolutely. Yeah, I find it really effective for endo. It's one of my favorite things to add to my patient's treatment plan.
Now, so it looks like we're looking, you talked about like the acupuncture engaging the parasympathetic, so eliciting the relaxation stress response. And that's important because I think in one of your blogs, you might have referred to once about managing stress, because there are studies linking stress to exacerbating, making endometriosis pain worse. So it's really important.
It does. Yeah. It makes the lesions grow. And then it doesn't support the really ideal state of hormonal imbalance in the body, because stress is, not good for the progesterone levels. And we're already fighting against so much estrogen dominance with endometriosis because the lesions themselves secrete so much estrogen. So we're always fighting against that. So the stress component is pretty important.
Yeah, we got to address all the lifestyle. And so
exactly.
Next question is going to be just a couple of your favorite supplements, but I just want to kind of recap some of the natural approaches. Then is there's dietary therapy, and we have a free AccuBalance fertility diet. It's an anti-inflammatory, low glycemic index diet. So for those that follow us, if you go to the AccuBalance.ca website, you can download that for free. There's lots of recipes there, and most of those diet recipes will support your endometriosis symptoms because it's an anti-inflammatory diet. And so, even if you're not trying to conceive, you can eat this diet. Exercise and stress reduction and good sleep. So these are the key things.
Yeah.
Then you've talked about there's acupuncture and low-level laser therapy, and then there's Chinese herbal medicine and supplements. Can you talk? I'm curious what kind of you like. Do you have like a top 2 or 3 supplements that not that every patient gets this, but they're the ones that come to mind? And I will put a quick disclaimer here. We're here having a discussion for educational purposes. We are not suggesting prescribing to anybody that's listening here. You do need to see your healthcare provider if you're going to take any of these supplements. But I'm curious with you, Allison, kind of do you have 1 or 2 that comes to mind when it comes to endometriosis?
Yeah, definitely. So omega-3s, definitely for the overall inflammation. Magnesium is really important for cramps. Vitamin D for the autoimmune component is also good for menstrual pain. And then NAC, or N-acetylcysteine, is kind of my new favorite for endometriosis. Just because there's that one Italian study a few years ago that showed significant reduction in painful periods, overall pelvic pain. And then I think so many of them were able to cancel their surgeries for endometriomas, where the cysts grow on your ovaries, because they just didn't have any more pain, or they got pregnant. So NAC is also one of my favorite ones for endometriosis, and specifically if there's a lot of pelvic pain and endometriomas.
Yeah, the NAC, the N-acetylcysteine, I really like that one. Magnesium, as you mentioned, the omega-3s, wonderful supplements. And a lot of clinics, just for those that are watching, will have naturopathic physicians and nutritional IV therapy. So a lot of our patients will do some IV therapy to bypass the gut issues and just to really saturate the cells. And so you get those B vitamins and the magnesium. And I like the glutathione. NAC is a precursor to glutathione, a mother antioxidant. So there's a lot of things that you can do, things that don't cost you anything. So diet, exercise, going to bed, stress reduction. There's so many free apps for meditation. So there's a lot of things that can support the body's environment to bring down this inflammation. There's a lot of things through diet, exercise, stress reduction, and sleep and habits can help with inflammation. And then you can add things to it like acupuncture, low-level laser therapy, supplements, and Chinese herbal medicine. So, you know, as you call yourself the surviving warrior, endo warrior, do you have anything that you just want to share with people that are going through endometriosis, whether they're trying to conceive or not? Just some words of hope and words of encouragement.
Yeah, absolutely. That pain management is doable. It is achievable. That surgery is not as scary as it seems, and that it can be really helpful if you're seen by the right gynecologist and surgeon and you are getting the right type of surgery. I mean, it is considered the gold standard of treatment for endometriosis. So, it is, an important component in the endo journey too. But yeah, it is possible to get relief of symptoms, because I do see it. In most of my endo patients, if not all of them, we are able to achieve some sort of relief of symptoms, I think, in every single one of my endo patients I've seen.
And the integration, because you mentioned the laparoscopic surgery, the surgery that's standard for endometriosis. Women that choose and need to have that surgery, the stuff that we talked about, that natural approach, is still important because it helps with the recovery. Yeah. But also, we don't want, because your constitution, then you grow back. It can come back, and so we want to slow down or not have it come back again. So you may need to have some of these lesions removed. Yes. Endometriosis. However, if you're doing this stuff, natural stuff leading up to the surgery and continue after, it can hopefully reduce the chances of any symptoms or endometriosis coming back, which is what you want. So I always say there's symptom management or Band-Aid. And so the surgery is kind of like that. It's going to give you some relief, but we don't want it to grow back. And this is where you get the opportunity to change your diet, lifestyle, stress reduction, and then you can add other natural approaches to support you. And then many women don't need surgery. That Fred Kahn, the vascular surgeon I mentioned, where he was sharing in the Norman Doidge's book, The Brain's Way of Healing. We have that clip on our website if you want to look at that from that book. But these women, a lot of them ended up not needing surgery. And we've seen that in our clinic as well, where they're able to find great symptom management. So there's things you can do. And so we just wanted to make you guys informed of that. Allison, thanks for this little Fertility Now clip. That's good to have you on here. And I'll see you with our mask on Monday.
Okay, sounds good.